we have the privilege of welcoming Professor Ahmed Banafa, who is an award-winning author and an influencer with his research expertise in Internet of Things, blockchain, of course, cybersecurity, and artificial intelligence. Today we will be discussing with him about about data privacy in relation to COVID-19. So, Professor Banafa, welcome.
Thank you. Good to talk to you.
So, as an average person, how much should I care about my privacy?
Privacy is important because there's so many things built on privacy. Your identity is really built on your privacy. Sharing your information without your knowledge, that could hurt you, could manipulate some of the activities that you are doing. So privacy always been an issue, and nothing more evidence of the significance of privacy more than what happened with Cambridge Analytica and what happened with Facebook itself and being under the microscope, and the other companies like Google and the other companies who really share our information without our knowledge. This is our information. We have to be worried about this. Identity theft, the dark web is built on the lack of privacy and the protection of our data.
What should the government vis-a-vis companies be allowed to access, and for how long?
The government has their role in the regulation, which should not be overreach. I mean, I know about the GDPR for Europe and the CCPA for California, where if there is a protection for your data, the companies, in a perfect word, should give you the advantage or give you the right to share your information or not. And if we want to go one step further, is the use of your information. I mean, they're going to pay you for it or not. They're going to ask you to, can you use it or not? Those are the topics that being debated before we get into the COVID-19, issues. But that is the case. This is my data. The government should protect me. The tech companies should respect that one and never use them without my permission.
How can blockchain be used to ensure my privacy?
Blockchain as a platform is a platform of trust, which means you put the data there and nobody can change it. That's giving. So nobody can access that without your permission. Nobody can modify it without your permission. And that is where the blockchain will come into the picture, which is securing the data itself. The companies are looking at this, and they understand that the blockchain model is really, a good model for security, for, scaling up the devices and scaling up the interactions. But it has its own problems, like it is slow. Scalability is an issue. The misconceptions about the blockchain being Bitcoin, all these things are not helping out with the spread of the blockchain.
So, Professor Banafa, let me start off the discussion with, I want to bring our viewers' attention to a recent article which you posted on blockchain technology and COVID-19. Could I ask you to just brief us on that? What are the key takeaways?
The article itself is talking about how can blockchain help with COVID-19 situation. It's not going to prevent the disease. It's not going to create a vaccine, but it's going to help with so many things. Number one is the concept of blockchain itself, which is a project that's now run by the World Health Organizations and many of the CDC, the Centers of Disease, Control in many countries, including China, Taiwan, the United States. They agree on something called, MIPASA, M-I-P-A-S-A. That one is built on a blockchain. IBM is leading that. Oracle is part of it, where they will have different nodes or different computers in different countries who agree to that, and they will start feeding this information real time into the database, and nobody can modify this. This is the assurance for the people to use this information, and that's going to help people to get the information quickly. about it. So this is one thing, which is control of the disease itself and the tracking of the information. And the second one is the famous problem we have with the supply chain of the medical supplies. That one will tell you exactly what stage it is, and will tell you if somebody is, using it, if somebody is a fraud about the product, if somebody is taking some of it. All of these things will help in this case. So the article itself is talking how can we use the blockchain itself to help us get to this point where we can trust the data, trust the process, because this is what's missing now. The data itself is scattered all over the place. And the process of the supply chain is really now a political, issue between countries.
So maybe going into the first part of your answer on the blockchain. I understand that, if I understand it correctly, that the tracking data is sort of collected in that blockchain, which is led by IBM, correctly? So
Right.
I know from Germany over here, and I assume that in other countries there are the same sort of thoughts that people have, or fears that people have, that once there is a tracking app used just for COVID-19 purposes, governments all over might exploit that app or exploit that data and carry it into the future and sort of create a new 1984. So how can blockchain prevent that, and if so, how?
Nobody will stop the government to use this information. We have recently a very rare partnership between Google and Apple to create a contact tracing app, and that one using Bluetooth, low energy, so it's not going to drain the battery of the phones. And they're using Apple and Google because you have total about 3 billion people using the two types of operating system in their phones. And there are a lot of concern about privacy. Now, to avoid that, which will answer your question indirectly here, Apple and Google, they said, we're going to create the framework. We're going to give you the API. The application programming interface, which is basically just the structure. The apps itself going to be created by the medical authorities or the healthcare authorities. Every county will create their own app. Every state will create their own app and then build it at the top of that framework. So that one will be coming from the government. Now, the next question is, what about our privacy? If you look at the design of the app itself, it's not transmitting any information about you. It is changing the data that used to track people. So, 90% you cannot get who is who and who is there or who used it. So it's part of the job of the technical companies, Apple, Google, Facebook, whatever you name it, to make sure that security is not an after thought. It's actually the building block for any app they're going to build that deal with this situation. And they did this one with this app. This app is not out yet. It's going to take at least 2 or 3 months to be in the hands of everybody. It's going to be part of the operating system. It's going to be turned on and off. Now, they're making sure that this information is not going to be shared. But there are so many holes in the system that has to be filled before, after that. Government will use that if they want. And that's why you have to be careful about how far you can get there. And the good thing about it, it's opt-in, which means you have to sign in for the app so you can be alert if you're close to somebody in the past 4 or 5 days who has COVID-19 positive based on the database, with the government. So this is the structure. It's a very tight line between protecting public and protecting privacy, and they're trying to walk that one very carefully. But the abuse can happen. There is no question about that.
Yeah. And then also on that app, apparently Google and Apple are giving their APIs, so it's easy to sort of build in that app into the operating system or make it as close to the operating system as possible. But will that be a global app, or do you think now that also sort of nationalism is on the rise again, not on or not last because of COVID-19, do you think that every country will basically have its own app?
Well, a good question. France, they're building their own something called Stop COVID. That's the name of the app. And, France is the same as Germany under the GDPR and their very strict, regulations for privacy. So they have their own app. Other countries like, Hong Kong, Hong Kong and China and the others, they have this. They have their own app. So the idea will spread. It's how they're careful about the privacy. For the case of the United States, they never mention anything about it's going to be out. It's going to be part of the operating system later on, 3-4 months from now, where it's a feature. You can turn it on and off. And it's not just for COVID-19. It's for any pandemic in the future. They say we're going to have it as part of it, notifications for people so people can see it. Now, I raised some questions about this with some of the reporter about the case. Even some people from the S&P 500 index, technical part of that one. There was some kind of discussion. The reporter, she asked me, so why people were even considered to get this app? It looks like it is really invading their privacy. The answer is actually twofold. Number one is education. You have to tell people exactly what it is, what's going to collect, and how it's function, which is tough because it has 3 levels of encryption, but you have to simplify it. Number two, give them incentives. If you install the app and opt in, and then you have a warning that you're being close to somebody in the past 3-4 days with a positive COVID-19, and you go to the testing center, you will have priority. You'll go in front of the line. That will be one thing. And also at the top of that, the more people opt in, the more people signed in, the quicker we can open the country or open the economy. That will be another motivation for them to say, okay, so it's worth it. Let me do this, and I can uninstall it later, or I can turn it off.
There are some other use cases even within the COVID-19 pandemic, I believe, right? I mean, one thing is, of course, the tracking of people and you're being alerted as an individual that you've been close to somebody who's infected with COVID-19. Couldn't it also be used to for the health system to know where people who have been infected and who are healthy again? And, because they can be they can make antibodies from their blood plasma, right? So that might be something which could help as well.
Yes, this is one of the things that they're looking forward to. That if even if you have when you have a positive and result from the COVID-19, you're not the one who's registering this information in the database of the health authorities. It's actually the hospital or somebody from the health ministry or so will register this, and because they want to try to avoid the false positive, people signing up themselves. I have a positive, so sometimes it's going to be used for fraud. So you don't go to work, you get help from the government, even if you don't have that kind of disease. And there's some cases about this where people claim that they have it, but they're not. So they're trying to protect that part of it. Of course, they're going to be using this one to track people, when it comes to the concentration of people, when it comes to the, where is this, how many of them, and where is the hotbed or the epicenter. Now, let me bring to your attention another invention, which is as simple as it is. It was really very effective in warning people about this could be, an epicenter or a hotbed or a spot for COVID-19. There is a local company here that has a thermometers, or a thermometer, that's the one that you test your temperature with. But that one is wireless, connected to the internet. It's part of the IoT devices. And this company collect the data. So when people test, their temperature, they send this to their servers. So what happened is they have a map of the heat of which before the COVID-19, they can tell you that the flu will hit this area. Why? Because the temperature of people are rising in this area. They use that one to say Florida got a problem, California got a problem. Same thing with New York, and they give you a warning: be careful about this thing, because we see that a lot of people, the temperature is above a certain level. So this is another way of using a simple device, IoT device, with the app of the company itself, to share this information with the public and with the government, to say we have to take precautions for this one, not to get into another hotspot.
How much?
Yeah, good. Rajiv, go ahead.
Sorry, just quickly. How much data would this company be collecting, just out of curiosity?
I mean, it's a lot actually because they're giving their thermometers for free. They give it for free. They have distribution for it for millions and millions of that, and the data itself is amazing. I can send you a link to their website. They have a a temperature map, and TV station like MSNBC. They have interview with them. Same thing with CNN. They interview the president of the company. It's a very simple idea, but it's very powerful because it's the timing of that. And it's very helpful when it comes to those kind of seasons of the flu season. It was intended for that. But they found that this is actually a precursor for temperature is high here. So we have to check this one. And this is good because you can go and test people in that area to make sure that you can catch the people who have that disease and then isolate them instead of, being going around. They have no idea what's going on with that.
Yeah, I've actually read about that company and the thermometers they're providing. Now, I know that there's been discussions, at least around here. Currently, if a country is under lockdown, usually it's the whole country under lockdown. But wouldn't inventions like those, like especially utilizing both the IoT and to some degree the blockchain, wouldn't that also enable countries to make a more distinct decision on what to open? So, for example, they're thinking here that the hotspots, they should keep the lockdown, but in other areas where there are some industries where there are a lot of people working, but there's hardly any COVID-19 cases, that they could open up these because obviously the danger of being infected is lower than in other hotspots.
I mean, your point is really a good point. The key thing about it is you don't want to drive in the dark. You need to know what's going on around you. And without testing, there is no way for you to know who is okay, who's not okay. And even with people with no symptoms, sometimes they don't have the symptom, but they carry the virus. That's the definition of the CDC when they say it's a very efficient virus, which is never seen anything that transmitted that efficient between a person to person hiding there, and you never know about it. So we need to know, which areas we should test, given the limited supply of the tests we have and the political, problems we have with the testing. At the same time, you have to be smart and selective about picking the areas where say this area will really hot area, we'll have to test it. So the Internet of Things help with that device. Blockchain will secure this kind of data, so nobody and have access to it from all over the world. There's no centralized, place where you can keep this data. There's copy of it. You update it everywhere, so they have an information about it, and it will help in the future by saying, we noticed that your curve is flattening. Can you tell us, according to the data you have in the blockchain, that's what happened? How did you do that? Exactly. I mean, Germany is a prime example of a country that took control of the virus before the virus decided, its way, and they're famous for having more, beds, more ICU, more all these things. They thought ahead of this one. So Germany is an example of that one. You can think about that. South Korea is another example of this that really took control of it. Singapore was a good example until recently, where they opened quickly, and now they have a second wave. They have to deal with this one because it was a quick decision for them. They didn't build it on, a really solid data compared to other experience from other countries. Don't open it until it is really safe.
So, couple of points here. First of all, in my introduction, I should have mentioned that the three of us are located in three different locations. Patrick, who is in Germany, myself, Rajiv, I'm based in Indiana, and Prof. Banafa is in California. So now it'll give you a perspective of when any of us say here. So I want to lead the conversation post-pandemic as well. But just prior to that, I just wanted to go into a little bit of what's happening in South Korea, and if you could probably enlighten us. If I'm not mistaken, what South Korea is doing is they're providing some form of geofencing. Isn't that correct? And so beyond a certain parameter, a patient who has been identified cannot leave if they do within law, I believe. While that can be quite effective, is that the most optimal way to enforce a behavior to combat such an ailment? Again, if you can, not from ethical perspective, I guess, because that could be a different issue altogether, but from a matter of privacy, because it takes away so much more information than just the person A with high fever is stepping outside their home.
Right. I mean, Hong Kong have bracelets. You have to wear it, and
Okay.
yeah, and they're really strict about it. Now, here's the thing about it. South Korea as a system and Hong Kong as a system is different from the United States, and the political system is there different than the United States. I mean, we have protests. The last few days, people who say, I wanna have my COVID-19. This is how people look at it. You cannot stop me from going out. They're breaking every single rule that CDC and the federal government is asking people to follow because they think this is limiting their freedom and it is actually protecting their life. But the system here is different, and applying the same system as South Korea, it's going to be very difficult because of so many regulation. People can sue, people can get out. So they're trying to make sure that the way, and I'm talking about California, it is gradual how they do that. And I remember how that started in California, where they say there is no more gathering for 35 people or more. So they're preparing you, and then they say 10, and then they say no one after a few weeks, and they say stay home. You cannot go unless it's essential. So they are giving this kind of understanding that people here are accustomed to a certain way of doing things. They can't just shut down the country like that. But from one side, this is okay, because you're dealing with a different crowd here. But South Korea did something else, which is the difference between life and death for so many people, which is testing. They opened those drive-through testing, and they started this phenomena of the drive-through testing all over the country. So they start testing and testing and testing. Because when you test, when you know who has it, who's not, you understand how bad is the situation. You understand what you're going to be ready for when you have the hospitals. It's not going to be like surprises. Suddenly you have an influx of 300, 400 people coming to you sick. That is the case for them. That's how they really control the curve by the testing. We don't have that much. We have 3.8 million people tested, as of today. Out of what,
20 billion.
20 million people in the United States. This is what percentage is that. That's not enough to know what's going on in the country.
So I think, do we know what percentage of the population did Korea test, and whether it was just those with the symptoms?
I don't have that information, but I can check that for you. I don't have it.
Thank you. Right. As I mentioned, what is also interesting for us, and Patrick touched on this about 1980, with reference to 1984 by George Orwell. How do we go about this once the pandemic ends, hopefully soon? How much does the big government sustain their activities in terms of utilizing our data? Certainly they have it, and there's no reason not to believe that it will continue to exist in some server somewhere. But how much should that information be exercised? And what kind of oversight can we as people in US and in Germany provide to manage how a government could utilize this information?
That's back to the technically in the United States, the Congress, which is you have your representative that will protect you, you express your concern about it, you have limitation on that one, you have all these kind of safeguards to make sure that whatever data they have is not going to be used for anything other than the main purpose for this, which is to make sure everybody is healthy. the government has more information about it, than you can imagine. But this piece of information is they're trying to. I'm talking about the tech company trying to make this one as anonymous as much as they can by saying it's just a signal. The only information that will be definite is if you go to the center and you test and you have a positive, then this information will go somewhere to say that you're being positive for this kind of disease. It's like any health insurance, any health information you have about somebody is testing and then they have it in their health records. It's going to register there. The fear is that the abuse of this kind of apps, that's the fear of that, which is people going to use it like geofencing, use it to track people, use it to all this. We have a sense of this one with the current phones. I mean, the GPS, as long as the GPS is on and running, then people can track you. The government can track you. There is no question about it. Whether it's through an app or through the operating system itself, they can track you for this. Those apps is just exposing what is already there about the tracking system the government is using, or not the government, all the companies are using. If you are using Android, Google will send you every month a list of the places you went through. It's like your activities. You went there, you spent that much there, you went to this place, you went to 3 cities, 4 cities, 5 cities. You look at these details. This is your life. This is exactly. Sometimes you forget that you went to a certain place and Google will say, no, you went to that place on that day and you went to that restaurant at that day. So this information is there and the government has access to it. Is what are they going to do with that? That's the key. And this is where you need the regulation to protect people. This is when you need your representative in the Congress to make sure that they're not abusing this. I mean, I always dream of having a GDPR version here in the United States. We have the CCPA here in California, which is similar to the GDPR, but doesn't have teeth. I mean, it's more like if you do this one, you're going to go to the court and this one, but at least it is controlling the situation. In the United States, there is no federal privacy law, period. It's all back to recommendation, like the FDA, for example. That's what they do with it. They say recalls or the car. If there is a problem with the car, you hear about the recall. They don't force them to do it. It's part of their customer service.
Right. Thank you very much, Professor Banafa, for the assessment on that. Certainly, one of the last points, which I think a lot of people would have concern over as well, is the private entities, the information that they have been constantly accumulating, and as a result of this pandemic, first of all, do they have license to collect more information on us?
They don't need a license, for this. I mean, there's somewhere in the fine print that when you accept that one, you open up for this kind of information, and that's why the next natural step for companies when they are collecting information to use something similar to what we have when you sign up for the credit card, which is you have a small table that tell you this is the name of it, this is the annual fees, this is the percentage, the APR, all these things, which is simplified so people can see it. Usually when you sign up for something like for any kind of an app or something, you have 5 or 6 pages of legal language. Nobody read it, nobody looked at it. But if they force them to have it in a simple format, very, a checkpoint where I look at this table and make a decision, right, what should I, can I have it, can I have that one or not? Number 2 is, if you say, no, I don't accept the agreement, you're not going to get the app in many of the situations. So what's the point of this? I mean, if I say don't accept, then you say, okay, thank you, bye-bye. So basically they're forcing you to accept it. So this is another thing that where you have the regulation comes to the picture there to say no. You have to be reasonable about it. It's like somebody offering you something, and you say, okay, this is the condition. You accept it, fine. If not, you go.
Right. Yeah. That is clearly the situation. It's my way or the highway.
That's true.
Right. And there's no free lunch, certainly.
That's true.
So I guess the takeaway from this is the way the whole thing would be regulated would pretty much be what's already established, and just further evolution of those policies in the law that needs to be put in practice. Well, thank you very much
No problem.
for the call. From Cybersecurity Magazine, we are Patrick, myself, Rajiv, and again, Professor Banafa. Thank you very much.
Thank you. Take care.